So yes, there are new factors that can have a bad influence on implantation, starting from the structural changes like polyps, submucal fibroids, adhesions. So yes, they have to be removed before the embryo transfer, but there are very delicate molecular changes like the change in the proportion of these senescent decidual cells, the natural killer cells. I would like to talk a little bit about endometriosis, because it is a very disease which really compromises the implantation. The problem is that the endometriosis foci are invisible in ultrasound when they are located out of the uterus and out of the ovaries. But we know definitely that the endometrium differs from the endometrium in patients without endometriosis by expression of some proteins, and one of these proteins is the BCL6. It was shown by American scientists that overexpression of this protein in the endometrium are harmful for implantation. It would cause the progesterone resistance and the development of endometriosis. So when these are pathological expressions, so the live birth rate will be, according to Bruce Leslie studies, like 7%. If we would treat it for 2 months with GnRH agonists, with the agonist of gonadotropin releasing hormone, so then we can improve our live birth rate up to 55%. So that is why we also widely use the immunohistochemical examination of endometrium for expression for the BCL6. Also, we make the detection of plasma cells and use hysteroscopy to exclude the chronic endometritis, because it's also known that the chronic inflammation of the endometrium can compromise the implantation, and the antibacterial treatment of chronic endometritis can improve our success rate of implantation in clinical pregnancy. Just a few words about subendometrial contractions. So these contractions, they occur during the whole menstrual cycle with higher frequency in the follicular phase, and uterus usually calm down at the moment of implantation. But if we have high level of these subendometrial contractions at the moment of implantation, so the uterus can just push out this embryo. There can be expulsion of the embryo out of the uterus. Normally, we do not see this contraction sound. To detect them, we need to make like 4 or 5 minutes record. Then we have to replay this video in 5 times quicker speed, and only afterwards these contractions will be visible. So if we have like 3 and more of such contractions during on the day when the embryo transfer is going to be performed, so we administer additional some medication which calm down the uterus. Usually it is antagonist of oxytocin, and we see a better results with such type of treatment.